OK， 接住落嚟咧就係我哋研討會嘅第一場嘅專題演講，主題係大家都見到喺熒光幕上面啦，就係支援幼兒時期以遊戲學習 Covid-19 疫情時期嘅挑戰同埋機遇。講者劉麗明教授係香港大學教育學院楊雪姬基金教授，幼兒發展及教育科，香港大學教育學院幼兒發展與教育講座教授，以及幼兒發展與教育研究聯盟 Core 嘅總監。呢個專題講座將會以英語進行，輔以中文字幕。So coming up next is our first keynote speech, supporting playful learning in the early years, challenges and opportunities in the COVID-19 era. Our speaker is Professor Nirmala Rao from the Faculty of Education of the University of Hong Kong. She is a professor of Serena H.C. Yang Professor in Early Childhood Development and Education, Chair Professor of Child Development and Education, and also the Director of the Consortium for Research on Early Childhood Development and Education, or CORE. So without further ado, let's welcome Professor Rao.
Greetings, my name is Nirmala Rao, and I'm from the Faculty of Education at the University of Hong Kong. I'm very happy to give a talk today at the Play Education Symposium of the Jockey Club's Play and Gain project. The symposium has been organized by our Center for Advancement in Inclusive and Special Education. I want to thank the organizers again for inviting me to talk on a topic that's very close to my heart, play. Play indeed is a powerful way of promoting children's health, learning, and psychosocial well-being. The title of my talk today is Supporting Playful Learning in the Early Years, Challenges and Opportunities in the COVID-19 Era. I will begin my talk by rehearsing some of the benefits of play for child development. Second, I will focus on recent conceptions of the relation between play and learning and discuss findings from research on the impact of guided play on child development. Next, I will turn to the impact of COVID on young children. Kindergarten closures, physical distancing, and stay-at-home orders have reduced children's opportunities for social interaction, play, and learning during the COVID-19 pandemic. However, we have seen innovations in the ways that schools and programs have connected with children and families during the pandemic. We have heard the term new normal to describe changes in our lives brought about by the pandemic. The COVID-19 pandemic has clearly had an impact on children's leisure and learning activities, and I will conclude my talk by focusing on the challenges and opportunities and lessons learned as we have tried to promote playful learning during the pandemic. Play is the most important strategy for teaching and learning in the early years. In the book, Einstein Never Used Flashcards, renowned child psychologist Kathy Hirsch-Pasek and her colleagues highlight the importance of play in promoting child development and learning and not focusing on accelerated learning. The authors, based on strong research evidence, remind us that it's important to support learning through play, and that learning through play is much better than the drill and kill strategies that are sometimes used. Another renowned child psychologist, David Elkind, argues that unscheduled imaginative play is very important in preparing academically and socially competent children. Children learn much through playing with others, and he urges parents to avoid overscheduling children with educational extracurricular activities and argues for the value of letting children play. There are many positive aspects to play. Children show positive emotions, active engagement, and social interaction during play. All these characteristics facilitate young children's learning. As professionals, we know the value of play, but many parents in Hong Kong do not want their children to be left behind at the starting gate of school, so they enroll them in lots and lots of activities. That stated, all parents want the best for their child. Hong Kong is a very competitive city, and there is intense competition for places in desired schools right from kindergarten. We know that middle-class parents send their children to special schools and tutorials to prepare them for admission interviews. Now I want to turn to playful learning. What exactly is playful learning? In the field of early childhood education, there has been a long-standing debate on the relative benefits of free play and direct instruction for children's learning and development. Some preschool curricula designs follow what we call developmental constructivist models that emphasize the importance of free play. By free play, I mean child-initiated exploration and discovery and positive social interactions. In contrast, an alternative approach focuses on teacher-directed instruction. This approach has sequenced learning materials primarily to promote literacy and numeracy. Developmental theory suggests that combining direct instruction, that is adult guidance, and child agency, that is free play, in educational contexts could benefit a wide range of learning and developmental outcomes. To put another way, developmental theorists such as Vygotsky argue for both adult guidance and child agency in educational contexts. Research conducted in the United States reported that children who spent large amounts of time in free choice activities were significantly less likely to gain academic skills than were children who experienced focused instruction or scaffolded learning experiences. Because of concerns about school readiness in countries like the United States, there's been a lot of focus on combination of free play and adult guidance. We have moved in our field to a notion of free play versus direct instruction to a notion of free play and direct instruction. So there has been a conceptual shift in early childhood education towards a play-based learning approach. Play is now seen as a spectrum with child autonomy and adult direction at either end. Guided play has been situated as a middle ground between free play and direct instruction, and I would like to spend some time discussing the notion of guided play. Before I do so, I'd like to take a few minutes to focus on the diagram in front of you. So we can see there is a continuum of playful learning. On one hand, we have free play, which is child-led. Then we have guided play, which is child-led. Then we have games, which are designed by adults. And on the extreme right, we have adult-directed content, that is direct instruction. So to put another way, we see play as a spectrum. Activities can be initiated by the child or adult. They can be directed by the child or adult, and we consider whether there is an explicit learning goal. For example, free play is initiated by the child, directed by the child, and there is no explicit learning goal. For all the others, guided play, games, co-opted play, playful instruction, direct instruction, there is an explicit learning goal. Guided play is directed by the child, but games, co-opted play, playful instruction, and direct instruction are directed by the adult. So the point that I'd like to get across is play is a spectrum, there's a continuum, and what we are moving towards today is this notion of guided play, which combines child initiation and adult guidance. So guided play is the middle ground between free play and adult direction. In the field, we use a number of terms to refer to the same concept. We use the term guided play, facilitated play, scaffolded play, purposeful play, playful learning, learning through play. All of them are the same things. They refer to the same thing, okay? An educational approach that falls under the umbrella of play-based learning. If we look at our Hong Kong curriculum, we talk about joyful learning through play, balanced development all the way. So Hong Kong, like the rest of the world, tends to follow this idea of guided play. For example, in Singapore, it is called purposeful play, but it's the same thing. It's a combination of free play and adult guidance. So what is the role of the adult in guided play? Adults are very important. They set up the play scenario, they determine the challenge, they scaffold. That means they support children's learning and they provide nonverbal guidance. So we talk about free play versus guided play versus direct instruction. Which approach promotes children's learning and development outcomes the best? What I've argued up till now is a conceptual basis for separating free play, guided play, and direct instruction. But what does research tell us? Well, a systematic review and meta-analysis, that is when the findings of many studies are combined together, considered evidence of guided play compared to direct instruction or free play. And the authors found that guided play was better than direct instruction in terms of promoting children's early math skills and shape knowledge, and that guided play was better than free play in improving children's spatial vocabulary. Now, we would understand that if because the teacher would need to explain, this is called a triangle, this is called a rectangle. Children are not going to pick that up on their own. They did not find any differences in terms of literacy, in terms of the direct instruction, free play, or guided play. I need to mention there were only 17 studies. Very few studies have actually compared these different approaches, but the field is moving towards doing that. Now let me turn to the impact of COVID-19 on play and learning. So on March 11th, 2020, nearly 2 years ago, the World Health Organization declared COVID-19 a pandemic. Nearly 2 years later, by February 13, 404 million people had contracted COVID-19, and there had been 5.7 million deaths. COVID has severely affected the way we study, work, and our physical movements. In terms of health and economics, it has already widened, and it's expected to further expand pre-existing inequalities between disadvantaged and more advantaged populations within many countries. It's also highlighted the stark disparities between high, middle, and low-income countries. In short, this globally changing, unprecedented crisis has affected all of humankind, and its effects are expected to continue for some time into the future. From a system science perspective, global pandemics represent a shock to the system, affecting every aspect of society. Relatedly, microsystem changes during the pandemic, such as lockdowns, curfews, stay-at-home orders, affect families, schools, and work life. As such, in considering the impact of COVID on child development, we need to differentiate between the impact of COVID per se and the impact of the measures enforced to decrease virus transmission. We need to note the varying impact of the disease on rich and poor families and recognize the role of protective factors in alleviating some of the potentially adverse effects of COVID-19 on children and families. COVID has affected families all over the world. In fact, there are only 4 countries that have not reported any COVID cases. They are North Korea and Turkmenistan, which people doubt the data, and Tuvalu and Nauru. Tuvalu and Nauru are 2 small little islands in the Pacific that have populations of less than 10,000 and less than 200 visitors a year. So they pretty much closed their borders and they've totally not been affected by the pandemic. But that's it's been everywhere else, right? And we've seen restrictions in the forms of lockdowns, curfews, stay-at-home directives. And these have undoubtedly affected play and learning. We need to be very mindful of the fact that unpredictability has affected parents and children. The impact of home confinement has varied based on child and family characteristics. For example, children and adolescents from dysfunctional households who were isolated in their homes for extended periods may have been subject to neglect and abuse, and typical methods for identifying maltreatment, i.e. school routines, routine healthcare visits, were drastically curtailed in the context of lockdowns. This has meant that children and families in need of support were often not identified and unable to receive services. Parents may also experience increased stress because of job loss, income insecurity, and be less patient with their children. In addition, contexts in which parents may have been able to work remotely, challenges existed with balancing work with children's learning and education. I'm sure we've all heard our friends talk about some of the challenges of working from home when they've had young children at home and they've had to support their learning. In fact, one of my friends was telling me that the school wanted her to take videotapes of PE lessons at home and send it to the teacher to make sure the children are doing everything. And this was quite challenging for parents. We are aware that COVID has disproportionately affected children from certain groups, children from economically disadvantaged backgrounds, and those with additional health or special needs, and those with limited access to digital resources, or those from families in which there are mental health addiction issues have been most impacted, right? We know this from data in Hong Kong as well. Children from economically disadvantaged families have been most impacted. They did not have access to digital resources. Children with additional health or special needs or low-income families or children from single parent families have been most impacted. Winnie Cho and Patrick Ip from our Faculty of Medicine surveyed 30,000 families in Hong Kong and who had children between 2 and 12 years old, and found that these groups needed special support. My colleague Nancy Law looked at the availability of digital resources in different families and found that low-income families may not have had access to a large screen digital device, which is really important for online learning. We also know from Dr. Cho's research and other research that there are families in which there are mental health issues in Hong Kong, and these children don't do so well when schools are closed. One thing we know is that family conflict increased during COVID, but also we saw higher levels of parental warmth, as well as parents reporting spending more quality time with their children. School closures have had a massive impact on children's play and learning. We know that schools were closed to prevent transmission of infection on school premises. And we don't want children going in public transport to and from school. So we know that the extent of school closures because of COVID-19 has been unparalleled in history. At the height of the pandemic, 1.6 million children did not attend school. And these children were in 190 countries. In some places today, children are still not attending school. School closures have had a tremendous impact on children's play and learning. School closures were really widespread during the pandemic, and we know that children had learning losses because of school closures. Okay, so we would expect this to happen very much in low and middle income countries where they don't have access to the internet, where they don't have digital devices. But we were very surprised to find that these learning losses happened in even high-income countries. And developmental researchers have been very, very innovative. So they've compared children who start school before the pandemic and started school after the pandemic time. So they look at nationally representative data, and we can estimate the learning losses. I wanted to quickly tell you about a study in the Netherlands, which used nationally representative data. And Netherlands is a high-income country, and they estimated the learning losses of 8 to 11-year-olds. This is a country where there's high internet access, above average performance in studies like the PISA and the TIMSS. And they found that students made little or no progress in learning during the closure in this high-income context, and that children from socially disadvantaged backgrounds made less progress than their advantaged peers. That we found all over the world. In many countries, children who are from socially disadvantaged backgrounds get free meals at school. We call it subsidized meals, or they provide meals in schools for children for poor families. And it's actually wonderful, the kind of innovations we saw. In countries like India, they opened the schools for cooking food for, and there was no learning, but they provided food to children. In America, some school teachers used to take packed meals to children's home, just because the school meal, the lunch that they had in school, was the only nutritious meal they had during the day, right? So we know that children from poor families were really affected by school closures in terms of their nutrition, right, and health. Many children do not have a quiet place to work and study, and they were really affected. Furthermore, we know that there's a digital divide within and across countries, and this really affected children's learning, right? So in some countries, there's very good access to internet, so children were able to continue their learning. But I'm really so impressed by the innovations of so many governments. In poor countries, they started using the radio to transmit classes, educational television programs. Like we have Hong Kong Ed City, they started broadcasting it on their national TV so children could learn. So I'll talk a little bit more about those innovations, but these innovations were really important to close the gap, the digital divide, right? Media use, children became much more savvy in terms of media use, and actually I'll present some data to show that children were actually using a lot more media during the COVID-19 era, and children's outdoor play was really restricted. In Hong Kong, we've closed playgrounds, we've closed many things, and physical play is really, really important for young children, right? It promotes their motor development and their physical development. Okay, so now I'm going to turn to a little bit about some of the findings from Hong Kong. And I want to thank my colleague, Dr. Stephanie Chan, for sharing with me all her slides. The following 4 slides are from her, where she summarized some of the research conducted at Hong Kong. So the Education University of Hong Kong conducted a survey in February 2020 with about over 6,000 parents of primary and kindergarten children. And about 66% of parents reported that their children had trouble learning at home. Okay, so one thing they found out is that kindergartens and primary schools were actually sending learning tasks to school. So only less than 6% of schools did not send any tasks to children, and the majority were sending daily tasks, right? But parents, about 75% of parents reported that children had difficulty concentrating, about 50% reported they were interrupted by other family members, and about 50% said parents said that they didn't have the resources like printers and all to support learning at home. Right? About 73% of parents of kindergarten-age children said their children had arranged online classes during class suspension, but parents reported a number of difficulties in supporting their children's learning at home, right? They talked about children's lack of interest, right? And it's more pronounced in kindergarten children, right? Especially doing things on their own. The instructions were difficult for kindergarten children to follow on their own. The EDU study also reported on the daily screen time. So about 28% of children spent 1 to 2 hours of screen time every day. The Pediatric Society and Hong Kong Department of Health recommend that we only have 2 hours of screen time for children of kindergarten age, right? So we really need to monitor children's access to screens. Also, we need to be mindful of the digital divide in Hong Kong. About 20% of families in Hong Kong reported not having access to the internet. And the survey by my colleagues, Nancy Low and all, found that there's inadequate access to large screen devices by about 10% of families, and about 18% of families did not have adequate access to digital learning resources. The EDB was very proactive, like governments in many parts of the world, and they gave lots of good guidance to families, to schools. They talked about the need to adjust strategies based on children's age and interests. They talked about the design of activities, and they highlighted the importance of homeschool cooperation. They stressed authentic learning, the principle of child-centeredness and play-based learning in the form of home learning and parent-child activities. So what I really want to say is that with young children, what happened during the pandemic is, as teachers and educators, we work with parents to support their children's learning, right? We don't expect the child to just watch the TV program and like we would with the older child and be an independent learner. So it's actually working a lot with parents, which was a positive aspect of the pandemic. And I thought it was really good that the EDB highlighted the advice from the Department of Health that children should not use screen devices for long durations, right? And that we need to be mindful of this. We need to ensure that the closing of school is not the suspension of learning, right? We need to promote learning, but we need to do it in ways that are developmentally and child appropriate. So let me now turn to some of the innovations that occurred during this era. And, you know, I think it's been wonderful to learn about some of the innovative practices. One of the wonderful things is that governments, NGOs, and programs have worked together in partnership to support the disadvantaged. I've heard so many moving stories from different parts of the world. And the minute this pandemic started, organizations such as UNICEF, UNESCO, World Bank, Save the Children, all work together with governments and NGOs to support children's learning. People adapted their content and engagement modalities so that children could continue to engage in playful learning and receive child-appropriate awareness messages to protect their health. My colleagues at the University of Hong Kong have done a lot of this, and I know the Jockey Club in its projects has really, in Key Steps, a project, and Play and Gain have really adapted their modalities so children's learning can be supported. And I thought that ministries of education, I gave example of Hong Kong, EDB, have been just amazing in their support of families and support of schools. And really, they want children to learn. Many parents want their children to be ready for school, but they are encouraging parents to be more attuned to children's needs and and showing them how to promote their development. I want to now quickly just run through some of the resources that were prepared. So I'm using UNICEF as an example, but UNICEF, WHO, SAVE, World Bank, and many organizations all work together to prepare these resources for parents. And I'm just going to show you a few of them. So this one talks about parenting in the era of COVID and how important one-on-one time is. Now, if you see at the bottom of this slide, it shows all the different NGOs, INGOs that work together to come up with these. And you know what? These are in, I think, 20 or 30 different languages. There's a Chinese version, and they prepared about 16 or 17 of these. We were involved in the development of these guidelines, and I think it's really, really useful for parents, all open access. So I just wanted to share because the one on learning through play, okay, this is one of them, because our focus is on play and learning. So, saying to parents what they can do, how they can tell stories, they can sing and move, right? So one innovative approach was to work with parents, particularly important for parents of young children. But they also had advice on, which I thought was very good, on online learning for, primary school children. They need to prevent children from getting cyberbullied, or children from, being connected with other undesirable organizations, etc. A lot was done to support schools and education systems. And here again, I'm just using UNESCO as an example. They provided a list of educational applications and platforms. The COVID pandemic has clearly been the worst shock to our education system in a century, right? And as I said, there were 1.6 million children and youth not attending schools for months, and many are still not back in school. So UNESCO is working very closely with ministries of education, public and private partners, and civil society to ensure continued learning for everyone, right? I want to actually talk about some of the positive things that have happened because of COVID-19 in terms of education. So many people said that we would have never moved to working from home at the extent that we have now if it hadn't been the shock by COVID. People were going to offices, and, we talk about the new normal. People will continue working from home. There have been some positive things about COVID, less pollution, people are not traveling, fewer people are getting influenza because people are wearing masks, etc. But there's been a massive transformation to the educational system. Linda Darling-Hammond is a very famous educator, and she spoke about the challenges and opportunities for teachers brought about by the pandemic. And what she argues is that educational systems have not changed in recent years to meet the needs of the 21st century. You've all heard of 21st century skills, right? But the disruptions caused by the pandemic have created a wide range of opportunities to reinvent education by opening up new roles for teachers to recreate schools, right? And what she talks about is teachers have joined hands to innovate and support each other during school closures by exchanging technical assistance, in using new technologies, curating resources, using digital platforms, and developing innovative pedagogies, including those that build independence and resilience in learning. Right. So during the crisis, teachers around the world have led efforts to connect students and their families to schools digitally and in other ways by ensuring access, sharing ideas without the teachers and parents, and by creating partnerships, right? The COVID-19 pandemic has also made clear the urgency of capitalizing on innovations that have emerged for creating child-centered approaches to foster 21st century education systems, right? So we have seen a positive thing on the educational systems. So let me now turn to the challenges and opportunities brought about by the COVID-19 pandemic. As we know, there's been a lack of social contact. Children wear masks all the time. You can't see whether they're smiling, you can't see the emotions. It's very important for young children. We're spending so much time in schools in personal hygiene management. I'd gone to kindergartens a little while ago, and teachers have to spend so much time making sure children are doing the correct thing, washing their hands. And there are many interventions to control the pandemic, such as closing playgrounds, schools, closing swimming pools, and children are not exercising enough. And this is increasing childhood overweight and obesity globally. So we need to be mindful of this. There have been opportunities. There's a greater awareness of healthy habits, eating, exercise, self-care skills. So we know that good habits develop when children are young. There's been an opportunity to develop resilience, flexibility, problem solving in the face of uncertainties and changes to usual routines. We've discovered alternative remote forms of learning and activities. And there's also been an opportunity to develop good relations. A survey by the Hong Kong Institute of Family Education reported that 75% of parents in Hong Kong reported improved relations with their children during the school closures in early February. And a study by the Hong Kong Federation of Youth Groups said parents had better relationships with family members. Well, about 45% of parents did, although 30% said their relationship was worse. We also found increased parental engagement. The Hong Kong Christian Service reported that online training with SEN children resulted in therapists being able to understand more about the home situations of children with SEN. We saw a lot of local resources being developed, which are really commendable. I'm just sharing some of the resources by our government. The Young Warrior Combating Against the Epidemic. So activities for parents and children. We're very want them to be developmentally, contextually appropriate for children. Lots of advice for parents. We are really working on parents because they're the critical factor. And, we see a lot of media and technology to support learning. So what we do say is that we need to choose objectives that are aligned with our learning objectives. We need to avoid selecting cartoons or YouTube videos with no educational value. Instead, we have to select interactive programming that will engage children in activities aligned with a learning framework and informed by research. We want to choose activities that will develop children's literacy, maths, and social skills. We want to focus on social-emotional learning and activities that promote children's relationships, self-regulation, empathy, and mutual respect, much like the Play and Game project does. And I think it's really important to extend learning from media. So technology and media can be catalysts to learning offline. We should reinforce skills and knowledge through related hands-on activities, music, child-generated content, etc. The best media ignite play long after the digital experience is over. And when children play pretend with their favorite characteristics, they may apply social, emotional, and emerging cognitive skills, right? We talk about something called a parasocial relation, which are one-sided emotional connections that children may form with an on-screen character, right? So this is Peppa the Pig, which is a famous child characteristic, and WHO developed a video called Wash Your Hands with Peppa Pig. So one, it's developing a parasocial relationship, it's encouraging health and hygiene. So it's not only when they're watching the media, they're singing, they're washing their hands, right? And we also say that we should encourage co-play. So we should ask children questions about their favorite media character, what they like about a program, etc. Okay, so the COVID pandemic has also offered us an opportunity to look at children's play diets. Just like a nutritious food diet, a healthy play diet is balanced but proportional. For children to achieve healthy development, they need to spend their time not just in digital play, but also with social play, active play, creative play, and free play. When it comes to nutrition, it goes without saying that eating too much of one food, even the best foods, just like eating too much fruit, right, is not too good. A child that spends all the time on active play, maybe neglecting creative play, right? So what we want to do is to ensure that children have a balanced play diet. We know that there's an ongoing controversy, particularly in the media, about the value of digital play to children's development, right? But today, evidence shows that digital play is undeniably an important component of a child's healthy diet. Not only does digital play prepare children for their future in an evolving and highly technological society, the most current research shows that if it's used properly and appropriately, it can improve academic performance and provide valuable experiences for social and emotional learning, right? At the same time, we also believe that we need to set limits, right? And have a balanced play diet, right? So we don't want children to have bad digital play habits. We shouldn't use digital play as a means of self-isolation or social withdrawal, right? And we need to have balance. There is a great need to support playful learning. The COVID-19 pandemic has brought with it many challenges to support children's playful learning, mainly through the closure of schools and outdoor recreation facilities, the physical distancing requirements, and not seeing extended family members. At the same time, we've learned about other ways to promote playful learning. We've worked much more closely with parents and children and had much more family and playtime. Children may have been supported to engage in creative and imaginative play and become more competent in digital play during this era. Thank you very much for your attention.
Thank you so much, Professor Rao. 好多謝 Professor Rao 一向對我哋嘅計劃嘅支持啦。 always so inspiring, you know， 即係成日都好有啟發性嘅。因為咧頭先剛才所講啦，個 play diet， 即係好似我哋成日都話我哋要講營養啊，身體要營養。其實我哋嘅身心靈，無論大人同埋小朋友嘅身心靈都需要有一個好良好嘅 diet。而 play 本身係個最天然嘅食品，一個溝通嘅語言。咁所以其實咧頭先剛才 Professor Rao 咧係提供咗好多唔同嘅研究同埋呢一個意見俾到大家。咁所以其實嚟講咧就係話我哋非常之好開心得到阿 Professor Rao 俾到咁大嘅支持同埋資訊俾我哋。咁其實頭先剛才我哋會睇到呢個 play diet， 令到我哋可以反思到去諗一諗，學校其實係點樣可以繼續喺間歇性停課啊，或者間歇性停授面授嗰陣時，尤其是係幼兒嘅情形之下，點樣令到學童可以繼續咁去學習，而亦都可以點樣去支援到家長。我哋提供咗好多唔同嘅資訊，但係資訊就好多啦，究竟我哋點樣去用咧？咁所以咧，正如好似頭先 Professor Rao 所講咯，喺我哋賽馬會玩學相長計劃裏邊咧，我哋調整咗好多內容同埋方式，令到小朋友都可以繼續喺一種咁樣嘅挑戰嘅情況之下都可以繼續玩。其中有一樣咧，就係所謂嘅好似Professor Rao 頭先剛才講嘅 guided play 啦。咁樣其實咧頭先都講啦，2022年嘅一個研究計劃已經講咗出嚟啦。唔單止係 free play 有用 ，guided play 亦都係非常之有效。而當我哋成日都講一樣嘢，我哋玩學相長裏邊嘅家長培訓又好，教師培訓又好啦，都係為自由遊戲做好準備嘅。我哋成日都講啦，我哋係要教小朋友學會學習，我哋通過遊戲教識佢點樣玩。咁然後佢哋就自己會研發變化遊戲，會變咗唔同嘅遊戲去解決佢唔同遊戲上面嘅困難。咁亦都係啲學習裏邊嘅技能嚟嘅。咁所以變咗咧，喺我哋參加咗我哋計劃嘅家長同埋老師咧，就係通過呢個互動嘅交流合作咧，可以帶出咗呢一個幫到小朋友嘅情況啦。咁佢哋咧學識咗啲技巧之後咧，就可以翻去屋企。就唔一定要上網去，因為家長係上網學啫嘛。佢學識咗之後，佢跟住就喺屋企環境裏邊咧，就配合翻學校就可以做到呢個效果啦。咁所以嚟講咧，我哋亦都係配合翻我哋個計劃裏邊咧，有好系列嘅學習資源。我哋就唔係鋪喺個網站度嘅，我哋有好多示範嘅短片同埋講座，點樣咧一步一步教家長咧點樣可以踏上呢個成功地開始玩之路。咁樣咧，而且咧，我哋有好多家居遊戲喎，因為我哋成日都推廣一樣嘢，當小朋友看到事物美好嘅一面咧，佢就會自動乜嘢都可以變成遊戲，只要係好玩同埋安全就得噶啦。咁而我哋嘅家居嘅遊戲有好多唔同嘅點子，亦都有實例，小朋友點樣可以喺屋企，家長係教識咗佢之後，自己係識得去玩噶啦，就係咁樣樣。咁而咧，我哋唔單止咧雖然做研究，但我哋唔單止淨係出書籍。我哋仲有好多通過好多個多媒體，例如我哋嘅有漫畫啦、動畫啦，甚至乎我哋設計埋有唱歌啦，同埋咧下晝我哋亦都會播放我哋點樣去跳舞，咁樣咧可以令到小朋友咧可以同五感裏邊可以學習到。我哋成套嘅計劃去配合咗，係好貼合咗香港嘅繁忙嘅香港人嘅需要，因為網上同埋網下都可以玩到，線上線下都可以做到。咁而咧，尤其是而家小朋友、大人都可以面對住咁多嘅唔同嘅挑戰，呢啲就可以正正就派咗用場啦。咁所以咧，我哋成日都講一樣嘢啦，就係話小朋友最叻嘅小朋友遇到最叻嘅老師係邊個咧？係令到佢對嗰樣嘢有興趣。而我哋最有令到小朋友最有興趣嘅第一個老師係邊個咧？就係家長啦。咁樣家長教識佢，咪就可以自由咯。